Hello, I'm Francesca De Donato from the Department of Epidemiology from the Lazio Regional Health Service in Italy. As we know from epidemiological studies, extreme temperatures and heat waves have an impact on human health. And it is important to make sure that we translate research into public health adaptation measures and prevention plans, such as heat health adaptation plans, which are really important, also considering future climate change and the increase in temperatures we will foresee across our countries and across the globe. Europe is a very has an aging population, and so the subjects most at risk will also increase over time. Heat adaptation plans have different core elements which need to be followed, as has been identified by the WHO. And in Italy, as in many European countries, heat adaptation plans have been put in place to ensure that the risks populations face during heat waves are reduced consistently over time, and we can respond and be more resilient to extreme temperatures. An important key element of heat adaptation plans is centralized governance and management of the plan. So identifying in a formal manner who is in charge of the heat adaptation plan, who coordinates an interdisciplinary table of different institutions and stakeholders and interest groups, especially thinking of environmental experts, public health experts, emergency services, social services, and any different other service that might be included in the plan. And it has to be written down formally. There has to be a formal plan which is discussed with the different parties so that everyone knows in a timely manner what to do throughout the summer during heat waves. So warning systems, which are combining both the environmental exposure and having forecasts of extreme events like heat waves, so extreme temperatures, linked to the impacts on health, are a core element of a heat adaptation plan in order to know when events are going to happen, make sure that prevention and emergency protocols are activated in time, and all the different stakeholders involved in the plan know what to do. Lead times of warning systems have improved over the years, as well as the resolution of models, and this has improved the actual performance. And this is a key element of a heat adaptation plan. So during heat waves and extreme temperature events, not the entire population is at risk in the same way. Epidemiological studies throughout the years have identified the elderly as being most at risk due to their characteristics and health status. People with chronic conditions such as cardiovascular, respiratory, kidney disease, diabetes are also most at risk during heat waves because their response to thermoregulation and the response of their cardiovascular system changes when we're exposed to heat, and so putting them most at risk. But also outdoor workers or adults engaging in very physical activity, small children and pregnant women, for example, have also been identified as being vulnerable groups exposed to extreme temperatures. And it is really important to know who the vulnerable people are within your population in order to target prevention measures and awareness campaigns towards these subjects, and make sure that everyone who is engaged in prevention and response knows what to do towards these people. Heat adaptation plans should include awareness campaigns, prevention measures and plans, and information and recommendations, not only towards the most vulnerable subgroups, but also to the stakeholders involved in the heat adaptation plan, informing what the health risks associated to heat are and what measures they should be put in place, and how you can respond to exposure to heat. For example, not going out during the hottest hour of the day, increasing the uptake of water and drinking more fluids, dressing accordingly, not wearing heavy clothing, having cool showers and cooling down if you feel hot, or the emergency services to contact if you're not feeling well. Evidence is continuously growing in terms of who is most vulnerable to to extreme heat and heat waves, but also response measures and evaluations and adaptation plans put in place. It is important that training for public health services, health specialists and social services involved in heat adaptation plans are carried out regularly throughout the year and updated in terms of information provided to the different services, but also hands-on training, group work, in order to make sure that all the different services engaged know what to do, know the response measures, and are aware of the literature and the evidence base behind response measures within a heat adaptation plan. Also engaging with the different stakeholders, having the different perspectives, and including it in current activities at a hospital level, for example, within local response and public health services, within social services put in place towards the different subgroups most at risk. These are important activities, or again, within schools, during pregnancy and contacts that patients might have. It's important that the different stakeholders have continuous training and information regarding the risks of heat. The monitoring of the impacts of heat waves throughout a summer, or measures that are put in action during summer in terms of evaluation of these actions, is really another crucial aspect of a heat adaptation plan, not only to monitor what is going on and adapting the response measures during extreme events, but also to improve response over the years. Because vulnerable subgroups change, actions put in place might change and modify. If we think of COVID, for example, other extreme events that occur during summer, for example, wildfire events, droughts, and other actions that might be put in place, it's important to evaluate how this phenomenon changes, how subgroups might change in response to that, and what different actions can be combined to ensure that the response is always increasing, always improving, and we improve our resilience in terms of public health response, but also population's response and resilience to climate change and extreme temperatures. The ENBEL project contributes to all this activity through the research that is provided in the different projects, information on additional vulnerable groups, better information on response actions for specific groups, for example, for workers, and different exposures that have been linked. For example, the exhaustion projects shows how the synergistic effect of extreme temperatures and air pollution also has an impact on populations, and how, again, public response should improve on this. And the link between health and climate change is ever more growing and needs to be addressed accordingly. Climate change will have severe impacts not only on the environment, but also on local populations, and public health response is crucial in order to improve our resilience and reduce the impacts of climate change. Heat adaptation plans are one example of how public health can really help respond and reduce resilience and adapt to climate change and promote a healthy well-being at the same time. So developing heat adaptation plans is an efficient system that we can promote in the coming years in terms of response to climate change. So thank you for listening, and I hope you implement your adaptation plan.